然后留下讲，我们就
开始，看得到吗？Live already.
live already.
Please start.
Okay.
Okay.
Hello, happy Thursday and good evening, everyone. So here we are at the live session again today.
Yeah, good afternoon, good evening.
So we are happy to have Dr. Derrick here with us today and also Dr. Jeff.
Hello.
Hi, good evening.
And you are Dr. Melissa.
And Dr. Melissa, yes. Okay, so our topic today will be a very interesting topic, which is about the crystal clear glow that everyone yearns for. Okay, I believe all ages of group of customers actually want crystal clear glow on their skin, especially on their face. Okay,
Crystal clear is like very shiny,
very shiny, bright.
very smooth,
Yes.
bling bling.
Almost like Korean superstar. The
Korean superstar.
glass skin.
Yes.
Glass skin.
Yes.
Wow, I love it. Yeah. Okay.
Okay. So, what are the criteria of this crystal clear glow that we always ask for?
Okay, I know.
Okay.
Crystal clear skin usually younger skin.
Okay.
Right, have to be younger.
Okay.
Then have to be very hydrated,
Mm-hmm.
fair,
Hydration.
very fair, and also very smooth
Mm-hmm.
and very firm.
Mm.
Yeah, and also no pores, no scars.
Okay.
The skin surface has to be almost very
Perfect
nice,
lah, I would say.
Delicate.
Perfect
yeah,
skin.
delicate. Okay.
So in other words means that the skin have to be flawless.
Yeah.
No
Yes,
scar,
yes.
no pores, no pigments, very smooth.
Yes.
Is it only Korean deserve to have that kind of skin, or any other people can also get that kind of skin?
So, of course, everyone deserves to have a flawless skin. Okay.
Yeah.
But actually, from the slide, you can see that these are the types of skin that everyone asks for. The Korean actors.
Okay.
Okay, bright, firm. Okay, no pores, even skin tone, very fair. Okay, So these are the
There's
criteria.
there's also another description. People see is like a kind of
Eggshell.
eggshell kind of
Ah,
skin.
okay.
Okay, so beautiful, right? Okay. So this kind of skin definitely is very beautiful because it shows the youthfulness, the energetic look, the healthy look, very attractive. Yeah. Maybe a person may not have a very good features of their eye, their nose, their lips, but with this good skin, they can still looks very beautiful, very attractive, and very very youthful. Yeah. So I believe that's the reason why every one of us is sorting out for this kind of skin beautifications or beautiful skin as part of our routine care, yeah, to prevent our
Aging,
aging.
prevent aging to look good.
So a lot of people willingly to spend a lot of some investment into beauty products, skincare, or even treatment. So today maybe we can discuss how to be more exact, how to be more confident, how to be really sure to get this kind of results. Yeah, regardless, maybe you want to use a product or whatever. How do we really able to gain this kind of results? Right?
So just now, Dr. Jeff already mentioned the criteria for this crystal clear glow. So what are the types of materials or ingredients that we have in our medical field that can actually help patients to achieve this kind of results? Dr. Derrick, do you have any idea on that?
Medical field.
Medical
Expert
Yes,
field.
we are professionals, of course. We use
Um,
safe products. Okay.
Definitely safe,
Yes.
effective, proven effective,
Yes.
and then to be used in the correct method or correct demand of a patient's condition.
some of the products that are shown to provide this kind of results, they can be categorized into different categories. One will be called skin boosters, meaning that these products will provide the hydration, will provide nutrient for your skin so that your skin will be healthier, more hydrated. That means your skin is more elastic, less wrinkle, less pores. The contour will be very smooth. The other types will be biostimulators, which are known to stimulate your own collagen formation in your skin so that the collagen in your skin will be more, the skin thickness will be more also. In another word, your skin will be firmer, more hydrated in a way also.
Okay, I think for the audience, maybe this way, to get this kind of crystal clear glow skin, basically we need to fulfill certain criteria
Yes.
of the skin. So this criteria actually divided into based on the anatomy of the skin or the structure of the skin. It needs to have a very healthy and very good quality of our outer layer of the skin called epidermis.
Yes.
Then also we have to have a very healthy and very good structure of the deeper layer of the dermis. Yeah.
Dermis.
Okay. So since these two layers has to be fulfilled in very good criteria or condition, so what is the subcategories of this epidermis? It has to be or what? Then about dermis, it has to be what? That kind of thing. I think this was always in our mind as a medical aesthetic doctors on how to treat and how to assess on every one of our patients to make sure they get the best effect out of the products they are going to choose. Yeah. So maybe okay, from epidermis, what we need to be sure is we have to have a very strong and healthy epidermis because epidermis stand as an outermost layer that give protection and also lock the hydration inside. So this epidermis has to be clean, smooth, no scars,
No wrinkles.
no wrinkles, no fine lines, and it also has to be strong so that the skin doesn't look dry, sensitive, peelings, and also no pigmentations or uneven pigmentations. And the more important part is actually this epidermis fully dependent on the dermis,
Yes,
the
correct.
quality of the dermis. Yeah. Then what are those criteria of the dermis that we should have? Only then we can get this kind of epidermis.
I know. Must have enough collagen and elastin.
Collagen, elastin, yes.
Ah.
Toing,
Yes,
that kind of feeling. Okay.
elasticity, collagen.
Good
To
hydration.
provide-
Hydration, yes. Number 3,
Number 3, yeah.
nutrients inside.
Yes.
Yeah. So it has to have a function, right? So the dermis has to have a structure which is built by the elasticity of the collagen. Then this collagen structure will lock in hydration. Then only the function of a dermis will carry out. So the dermis will carry out the function to prevent inflammation, prevent dryness, prevent aging, and also stand the, as a resistant to stand the damage from the environment, from the sun, from the UV. Yeah. So intact collagen that actually is the outermost important part of the healthy skin. Of course, on top of it, it has to have good hydration, and then the function comes in all together. What do you feel?
Definitely true. So there are many studies that have shown that younger collagen is different from those who are aging. As you can see in the photo that's portrayed on your screen, younger, healthier collagen is much stronger, straighter, they have more elasticity, they do not break easily. Okay. So when we age, this collagen production become weaker, and the collagen quality is weaker also. In terms of the strength of the skin becomes looser, so we get looser skin, wrinkly skin, thinner skin.
Yes.
And
At what age we actually will start aging like this?
around 20 to 25, we will start to age already.
Means 25 have to start indeed.
Yes, yes.
Okay. But maybe not obvious yet lah. It
Yeah.
start to happen, but you may not seize it yet. Yeah, because it lose about 1%
1%.
per year. So maybe you start to see more obvious losing out collagen by when it's about 10 to 15% onwards. So which is about 35 to 40 years old. So you start to have some fine lines, some laxity of your skin. So this is when you start to notice. But in fact, this losing out of collagens started as early as 25 years old. So and losing out about averagely 1% per year.
Yeah.
So means 100 years old means 100% lost.
Almost 100%.
Well, that's scary, right? Yeah. So people believe if we understand this physiology, the natural way of aging, so are we like in a wane condition that we are like tackling it, or is it something worth to do it to tackle to prevent or to slow down the collagen losing out? Is it worth to do it? Means those treatment, is it really effective? How does it relate to the beauty maintenance?
Yes, of course, because that's why we have to start this kind of treatment as early as possible, as early as 20 plus even. Okay, not to wait until 40 plus, then we start anti-aging treatments for this crystal clear glow skin. Yeah, so if you start early, of course, you can build up the collagen or the hydration even earlier. That will help in prevent or delay your aging process.
Most
or your
importantly,
collagen growth.
when you do it at this early age, not only prevent, but you can see even more beautification on yourself.
True.
Yeah, because you have good quality of skin. And with this enhancement, it further promotes better quality. So that it delays the damage and aging.
It also maintains your youthful appearance much better.
Since you are young, you should be appear
Yes.
as youthful as possible, isn't it?
Yes.
And also save money because you start early. So when you are aged, you don't need so many sessions of treatments as compared to those who started late.
This makes sense because if we are like comparing this kind of treatment to those skincare products, if we are comparing value to value, means results to result. If we want to have something evidence-based, proven, effective to prevent collagens and promote collagens, in terms of product, it doesn't really 100% or sure that can really do this. Certain products, we say, anti-aging, very good. Yes, they absorb and you do see some improvement. But that only stay up to certain layer or uppermost layer of the skin. Doesn't really penetrate fully. So in
Yeah.
that kind of value of result and those price that you spend or the money that you spend compared to this collagen stimulator treatment, mostly it comes from microneedle injection or certain way of doing it in a very safe method. But the value is much more better or higher,
Yes.
more proven, more effective, evidence based, isn't it? Yeah.
This is also because the topical treatments, they don't usually stay on the skin for very long term.
Yes.
Because our skin will shed every 28 days. So you have to keep on applying constantly to see the constant result.
Okay. Imagine, let's say if I get a very good product, I apply every day.
SK2.
Yes. We blended one, people knows. So then you apply. After we stop using it, lovely. How long the result without applying may last? Typically, 3 months, 6 months, a year,
I think will be lesser than that.
lesser than that.
Yes.
Averagely, we notice from experience, of course, there are no available studies to study on this, but from observation, basically about 1 month to 3 months, averagely, people start losing out the effect from a product since stopping it. Yeah, the reason is because based on the natural function of the skin shed off and renewed, and those ingredients that actually stays inside the skin will slowly shed off, and you do not see the effect of the product after a month. Yeah, because the skin renew after a month, almost new skin already. Yeah. So unless you shed slower, maybe you have been using the product for longer before that, so you may still remain to have some certain result balance. But after 3 months onwards, averagely almost every one of us do not see any more results from the skincare. But if that is compared to this skin stimulator injection, I think that give you even up to 9 months, even a year kind of results.
Longer lasting result.
Yeah, the only thing is how we make it as a mathematical calculation. Of course, on one hand, you are losing out 1% per year, and you are adding this in, and you are trying to add back another 1% to 2%. So you may meet a net or maybe positive gaining of collagen. So in this sense, if you do it continuously for maybe 2 years, 3 years, then you will starting to see younger and younger. But if you do it only once, probably you just make it net. So maybe next 1 year, 2 years, you do not see big different changes of aging. So this is significant, especially at a middle age group, around 30 to 40 years old. When we are reaching about 50 and onwards, and you have never done this kind of treatment before, of course, we need to catch back, all those loose collagen that you've been losing before that, maybe 20% loose out. So you need to do at least 3 to 4 years.
More sessions.
Yeah, more sessions and also consecutive years of doing. Then you start to gain the result more obvious by second year, third year, fourth year onwards. Yeah, this is sort of like evidence-based, I would say, based on a lot of studies and evidence that we are looking at. Yeah. Okay, good.
So what happens in aging skin? So this one I think we have already discussed just now. So I'll just repeat. So when we age, our collagen will be lost, like what Dr. Derrick mentioned, 1% after 25 years. So what are the other anatomy structural changes when we age? So the first one that we can actually see from our naked eye is actually wrinkling of our skin. Okay,
Why
that means the
wrinkling?
fine lines, the epidermis layer.
Become thinner.
Yes, thinner.
Because when the collagen losing out, the fibers structure of the mist become collapsed.
Lesser, yes.
They become thinner, and then the elasticity of the skin, become lesser, so it become very flaccid,
Very loose.
very
skin.
loose. So it start to lose out the hydration. So the plumpiness of the skin also losing out.
It's lost.
So in this case, you can imagine it's like a deflated kind of structure. So it becomes shrink and also become flaccid, and also very
very saggy, not
yeah.
firm. Yes.
So this is how the skin present. But what underlying it
What's happening inside? Yes.
is actually a collagen losing out,
elastin broken.
Losing out hydration, and also
Thinning of the skin also.
thinning of the skin. Yes, yeah. So how to tackle each one of it? Okay, before that, is it the same way of aging for everyone, or is it something a little bit of variance between every one of us?
This would be the general principle that everyone goes through, but of course, the aging process for everyone will be differ due to many factors. One will be genetic, the other will be sun exposure, lifestyle, and product usage also.
Okay. So if a person always exposed to sun, they will age faster.
Yes,
Yes,
definitely.
definitely. So we have seen so many already, especially in those countries where people like to go out and sunbathing. They could like to go to beach. So we see the skin becomes very, they age faster compared to the other people who don't do a lot of sun exposure. So they have all these features. The skin is very wrinkly, a lot of sunspots, very dry skin. Some even can develop skin cancer from long-term sun exposure.
How to explain the exact mechanism, how it forms?
So what we notice from all this research is this sun damage, this sun will damage the skin cells in the DNA level. So the regenerative, the repair of the skin cells become weaker. So it accumulates over time so that our skin become weaker and weaker and cannot replace the skin cell as good as when we are young.
So the rate of replacement is slower than the rate of degeneration.
Yes.
The rate of aging is faster than the rate of
Repairing.
repairing. So in this sense, as a net outcome, we are losing out. Yeah. So how dangerous is the UV? I think, and it's more dangerous in the fairer skin type.
Yes.
You see, fairer people will age faster in this sense. Yeah. How about lifestyle? Yeah.
Yes, of course, lifestyle, it actually affects most part of it. So example of lifestyle that can fasten or accelerate aging process are actually such as diet. Okay.
Okay. What kind of food? If I eat a lot, I age faster.
Okay. High sugar,
High sugar.
high
Okay.
glycemic index food.
So I agree.
Yes.
Yeah. Okay.
Okay.
How about? Okay. And why is this so? Maybe a lot of people think, yeah, you agree, but is it really related?
Yes, definitely. So because high sugar food can actually affect our gut health, okay,
Alright.
which then bring on to inflammation in our body. That can
Yes.
make our cells, including our skin cell, body cells, okay, our organs to age even faster.
Okay. Here, many of us actually notice if we consume a lot of sugars. Yes, what Dr. Mesa mentioned is correct. It's actually it boosts up this character called insulin resistance and create a lot of toxic or we call it free radicals.
Yes.
So these free radicals is a favorite kind of favor to stay inside the capillary beds inside the skin. So that what you will feel is your skin become drier. If you notice your skin always dry, yeah, maybe you're not eczema or a disease condition, but just dry. So this means that your body has a lot of free radicals are running overall throughout your body. Yeah, from where? From high sugar consumption. Yeah, it can also from certain fast food, a lot of unhealthy foods. I know you mentioned those fried things. Yeah, a lot of these preserved foods. Yeah, and also a lot of these high flavored, too delicious food. Simple to say. Yeah. How to prevent it? Usually try to take more wholesome, whole food. Try to take more nutrients packed, healthy, natural kind of characters of the food. Yeah, that will prevent you from having this kind of free radicals build up in the body.
Okay. Then the second lifestyle factor will be our stress level.
Stress.
Yes, stress can also increase our free radicals in our body. And the third one will be our sleep. Lack of sleep can actually also accelerate our aging process. Yes. So you can see that people who are lack of sleep actually age faster.
See, a lot of people confuse here, you know. Is it, wow, I lack of, maybe today my skin feel dry, I feel looks tired. Then I thought of like, oh, maybe I'm lacking of sleep yesterday. That's the reason. But indeed, okay, lacking of sleep is not like 1 or 2 days, not overnight. If you are lacking of sleep over time, okay, it actually become a behavior. So this behavior is actually an underlying subconscious stress, which you never realize. Which means that if, let's say, one day if you slept well also, it doesn't really sort of clear off this kind of characters, your body still retain a lot of toxics from this unhealthy sleep pattern over time. So that create aging because of these free radicals. Yeah. So if you like to have a good, healthy, and beautiful skin, make sure you cultivate a behavior of good sleep quality or good sleep behavior, not just 1 or 2 days. It has to be a continuous. Okay.
So to add on to the diet wise, we malnourishment or lack of nutrients can also cause our skin to age faster. So it's important to have a balanced diet, which is complete with macro and micronutrients in our daily diet. Yes.
What kind of supplement then that helpful to make our diet more complete and prevent aging of the skin?
One of the nutrients that's very important in skin would be vitamin D3. So vitamin D3 is normally produced from the sun, but when we check the levels through blood tests, we notice that a lot of people they don't reach the normal level of vitamin D3. Means that even for us Malaysians living in a tropical country, we Malaysians don't have enough vitamin D3. And what this vitamin D3 does to our skin is actually it promotes a healthier skin, better skin barrier, so that our skin will have that good texture, good glow. So vitamin D3 is one of the supplements that is easily available, and I think most Malaysians should take it.
Okay, since we mentioned these those are factors that causing our aging up. Let's say happen, it just happened. We can't cope with it. We just ignore or avoid, and then my skin is always dry. When it's dry, okay, what as a aesthetic treatment of skin beautification targets that we can aim to help our skin from dryness? I heard something about hyaluronic acid. A lot of people thought it's something dangerous. Is it so?
No, our skin has also produced hyaluronic acid on its own.
Okay.
So if you have dry skin or aging skin, actually your hydration of the skin is lacking. So skin boosters that contain typically hyaluronic acid based injections basically can help to solve this hydration problem. Okay, but when you age, because your hyaluronic acid production is also lesser, that's why we need some booster in the form of injections, external forms to help to boost up your hyaluronic acid content. And HA or hyaluronic acid, actually it attracts water or moisture. So when it injected into our skin, it attracts moisture and makes our skin look plump and glow. So that's how it works.
Is it people call it skin booster?
Yes,
They
skin booster.
usually use this hyaluronic acid, and this hyaluronic acid it can be delivered into the skin through multiple ways, and most of the time it's like a kind of
injection.
The kind of gun,
small
needle injection through a gun method, or even manual injection. And also from doctor's skill, it could also be delivered through some special doctor injection technique, painless. So I think basically this skin booster thingy has been there in the market for quite some time. Just that people couldn't understand what is the real function or purpose of this product, or how it really works, and who should do it. Maybe we can give some idea to our audience.
Who can do it?
Skin boosters are suitable for those who want to improve their skin textures, hydration, a bit of wrinkles. So basically, anyone can do skin boosters to boost up their skin, to improve their outer skin quality.
Okay, everyone also can do it. And if you feel your skin is dry, and if you always have that kind of lifestyle that we mentioned just now, unhealthy food, unhealthy sleep, unhealthy stress, you can do it to prevent your skin from aging. As we mentioned earlier on, the result is the hydration effect is much better than comparing to your skin product when you apply. Because hyaluronic acid is actually present inside the dermis, not just the epidermis. So if we are able to deliver hyaluronic acid inside the dermis, it gives a better efficacy compared if it just applies it on top of the skin and the absorption just remain on the epidermis layer. It doesn't go deeper. So the hydration doesn't really get into the place that it's supposed to be. So the function is not optimum for that. Yeah. I think the method of delivering it is very important. It's quite crucial to
Yes.
determine the outcome and results and the benefits or value of using it. And then everyone is suitable to use it. And if a person been using hyaluronic acid, actually the benefits of the skin it actually helps the skin to lock in hydration, and the hydration will carry on a lot of nutrition in our body to the skin itself. So definitely you let the function of the skin becoming better. So to prevent pigmentation, to prevent slow healing of any damage on the skin or any scars. I think that is one of a normal character of a skin when we are targeting to have this kind of crystal glow. Uh, so hydration is one of a crucial most item or factor that we are looking at. So it has to be as exact layer and also proper delivery method to achieve. Let's say beside hydration, what else we can do to promote good skin quality? Collagen, anything that we can do to promote collagen? Are those skin booster hyaluronic acid also promote collagen?
Not really.
Yes,
Not
not
really.
really. So
Okay.
is there any other ingredients or any other methods? Medically, aesthetic treatment is evidence-based, proven, safe, effective, painless, tolerable, acceptable for everyone. That can help people to gain back the loose collagen. Yeah. So anything?
There are a few of these so-called biostimulators that can
Yeah.
stimulate collagen.
They
that
name
we
it
use.
biostimulator,
Yes.
same as collagen stimulator.
Yes.
All right. Okay.
So there are few materials that have been in the market for a very long time, and we have been using it. That's long-standing with time. That means safe. And the common ingredients that are usually in this kind of collagen stimulator will be calcium hydroxyapatite, poly-L-lactic acid.
Okay.
Any more else you want to contribute?
PDLLA.
Okay. Polylactic acid actually is an isomer.
Isomer
Different
PLLA.
technologies. So it's actually a kind of second generation or third generation of PLA. Another one is PDO. So people heard about PDO usually from a material of threads.
Mhm.
Yeah. So we are lucky to see that in the sort of like new advancement of the studies and medical literatures and researchers, it gives better options and better scientific proven ingredients to help us as a doctor to tackle those natural process of aging better. Yeah, we know when we age, collagen losing out. What build collagen in the skin is a cell called fibroblast. It's a very fragile, very, I would say, kind of victimized cells in the skin. Yeah, so nothing much can really protect the fibroblasts. Besides hydration, what you can do from hyaluronic acid or from products. But the thing is, these cells sort of quite fragile. If you don't really protect it, you don't really sayang a bit. So the cells definitely will just lose out by itself. Yeah. So the younger you are, when the cells still remain, you try to do something to make the benefit out of it. Try to make the cell grow back the collagen. Yes, this goes to the idea that if let's say if you already reach 60, 70 years old, then your cells has damaged. Means your skin has not only lose out the collagen, but you also lose out the cells. So by then, if you are doing this biostimulator, you may sort of expect that your skin may not respond as good compared to when you're younger. Yeah. So try to do this skin collagen stimulator or biostimulator as younger. Yeah. So the sign that we are always looking at if you are already in the direction of losing out this fibroblasts is when you're starting to have thin skin. Thin skin, then you are starting to have wrinkles, pores, and your skin tends to be lax. When you do pulling, become less tensile. Elasticity of the skin becoming weaker. And of course, on top of it is lacking of hydration. Because collagen is the foundation of your skin to lock in hydration. Yeah. So when you have all these symptoms, you are losing your collagen, and this is a timing for you to consider some biostimulator or collagen stimulator to grow back the collagen from your fibroblasts. Those mentioned ingredients like PLLA, PDO, yeah, calcium hydroxyapatite are more than 20 years in studies, proven evidence in terms of safety, efficacy, results, and the method of delivering is already very well established. Yeah. So maybe we can share a little bit calcium hydroxyapatite. Yeah. A little bit of spatial about these ingredients, Dr. Derrick. Yeah.
Calcium hydroxyapatite is one of the very good collagen stimulating agents that we have been using. And what it does is when it's injected into the dermis layer, it will stimulate your fibroblasts
Yeah.
to
Grow
produce
collagen.
this collagen in a non-inflammation condition. So meaning that all the collagen that's produced is in a healthy environment and you get a very good firming result, thicker skin result.
Yes, exactly. The key point here is non-inflammatory or regenerative because our skin grow collagen, it has go through several processes. So first processes usually start with inflammation, then only it go to restructuring or regeneration, then only it come to remodel. So okay, these are all medical terms. So means you have to damage first, then only you grow after that you have to restructure. Yeah. So this calcium hydroxyapatite, it helps the skin to grow collagen without going through the inflammation phase, and it straight away jump into a sort of restructure or remodeling phase or sort of granulation phase lah. So which is healthy to the skin. Yeah, so the skin needs something like this, and it grow faster, and usually we see results within 3 months, 6 months, and it lasts quite long. As long as you doesn't lose faster than it grow, definitely you will see a net improvement over time. So this is what fantastic about calcium hydroxyapatite. There are several brands in Malaysia, and at this moment, you come to us, we'll let you know what brand it is. Okay. How about PLLA?
So PLLA is actually another type of collagen stimulator that's readily available in the market. And of course, PLLA, it comes in different forms and brands as well, such as PDLA, that's the isomer. So, and the layer of injection, of course, is in the dermis, but not all areas can be targeted. I mean, like, not the whole face can be targeted, only certain areas that can be targeted using this PLLA injection. Yes.
Okay. We are also lucky to see that this product has a lot of improvising over time. So PLLA was initial, the earlier most ingredients we found out which stimulate fibroblasts to grow collagen. And the ingredients are very simple. It's just a lactic acid, which is a kind of usual acid that grow in our muscle when we are fatigued. After you exercise for a long period of time, your muscle become fatigued, and then the muscle will accumulate this fatty acid. So this is a very natural ingredients or substance in the body, cause no harm to the body. So this PLLA is actually a kind of recombinant, or we call it restructured ingredients in terms of lactic acid. When we injected or delivered into the skin, it will turn into calcium, and not calcium, it turn into water and carbon dioxide. Very safe metabolites and doesn't cause any side effects in the skin or in the body. So, but indeed, when it changed into this carbon dioxide and water, it deliver a stimulation onto our fibroblasts so that your fibroblasts grow collagen. Last time when these ingredients came out in the market, so it can only be injected on the back side of the face because this area is more stable structure and doesn't run, so the solution can actually get there in a safer method. But with this improvise of this product and different brands with technologies coming in, we are glad to say that now we can even target near to the skin, around the eye, and also foreheads. How lucky we are, because with this advancement of products, we can now use this very fantastic background of the PLA, and we know sure for the result it can be used in this very tiny crucial area that we always have complaints about. You see our wrinkles always present here. It doesn't present here a lot. Rather, it's more here and it's more obvious here, and also over our eyes. So with this good establishment of these ingredients, now it gives a very good option for us to target this kind of issue for our patient. And of course, last ingredients that we want to share to you all today is called PDO. PDO was a kind of ingredients being used in the market a long time ago, up to now almost 30 years. And we used to know PDO through thread leaves. I think thread is not something not so familiar for a lot of people. A lot of people are very familiar with thread leaves. But thread was pleasant as a kind of thread, a real material of thread, and was inserted into the skin, and it sort of stimulate collagen from there. But now we are having another revolutionized PDO in the
Powder form.
in the powder form.
Yes.
I would say fantastic, because in the powder form, it actually diluted into a liquid condition or substance. It can be injected very homogeneously, even up to the corner of this thin skin around the eye, the corner of your nasolabial, the lips, even the neckline. You can target every area that you want, even on your arms, on your body. It is fantastic. Yeah. So because of the solid foundation and background of these ingredients and the revolutionized technologies on top of these products, now it gives another new light to us, yeah, to treat our skin, especially on the collagen part. So if you are aiming to get this crystal glow skin, we are one step nearer to our aim that we are going to achieve. Yeah. So to be summarized, okay, actually to achieve this crystal glow skin, we need to target hydration, we need to target collagen, and also number three, we have to keep the skin function as good as possible, which you will come along certain ingredients as active ingredients or growth factors in the market that can help us to make the skin function better. Yeah, maybe you can share a little bit to our audience so that they can also get to know what are those products or ingredients.
Okay, yeah. So the third category will be what Dr. Jeff mentioned on skin nutrients that helps to keep our skin functions up to date or up to our age. Okay, so what are skin nutrients? So as the name suggests, it actually helps to give nutrients to the skin. Okay, so the examples of it are actually exosomes. So have you heard of exosomes before? I believe it's
Not very
it's very
famous.
trendy,
Yeah, trendy now,
very
yeah.
trendy now, these exosomes. Because most of the customers who come in actually mention or they know more, even more about exosomes. So skin exosomes are actually, okay, what are skin exosomes? Exosomes are actually small vesicles that is actually excreted out from our cell that helps in cells to cell communication.
For example, you want to ask me to do something.
Yeah, I want to ask you to do something.
You give me a messenger pack.
I'm the messenger. So exosome is actually the
It's
messenger.
like a courier pack. You deliver to me, then I
okay.
open. Oh, I know what she wants to tell me to do.
Yes.
Okay, so this is exosome, right?
Yes.
Yeah.
Okay. That helps in regeneration and repair of the
Alright.
skin. Yes. So these are basically the function, and exosomes can be injected anywhere where you have problems. For example, your face, your neck, your hands. Okay. So these are the areas targeted for exosomes. Okay.
Yeah.
For skin health lah.
Usually it can be used for a lot of healing purpose. If you have a PIH, if you have scars, if you have a very unhealthy, sensitive sort of allergic skin,
Yes.
it does really good job in terms of this helping the skin quality or function of the skin to heal, to regenerate, to come back to the balance. Yeah, I think this is something fantastic with advanced technologies packing at the back of medical aesthetic. Yeah.
And it's very safe because it's protein, it's vesicle, it's not from cell or it's not from animal, not from human.
It's antigen free, it's
Yes.
DNA free,
Yes.
and basically it is non-animal based most of the time. Then what else? It's actually painless during injection. It's not something acidic. Yeah? And most of the exosome in a pure manner or pure form, it does very safe to the skin.
So these are the three main categories
Mm.
skin enhancement on crystal clear glow skin that we can do. Skin boosters,
Yes.
biostimulators,
Mm.
and also skin nutrients. So what are the other skin nutrients besides exosomes? that
Usually
you would
there
like
are a
to
lot.
share?
Last time when in the market we do see a lot of growth factors.
Oh, growth
Epidermal
factors.
growth factors, those are the things we
Okay.
use. People use PRP,
Oh.
platelet-rich plasma, take your blood and extract those ingredients out of it, then
Mhm.
use it on the skin to promote hydration and also healing.
Healing.
So those are the time now when the exosome technology coming in, actually more and more people are using this, and the result is much more superior compared to those before. And not long ago, there was quite common in the market called PN or PDLN. It's a kind of extracts of DNA, okay, from certain salmon, sort of like synergistically stimulates the cells, our skin cells, to regenerate or stimulate the cells to become more active. So that it heals. So this go along, if you compare to exosome, I would say yes, it goes very well. It's a synergistic form, makes the function even better. So if you are looking for something stronger or better, you always come in combination or even both you can consider to do. But of course, these ingredients, it doesn't replace collagen, it doesn't replace hydration, but it promotes your skin to stay on healthy in terms of function.
So it
If you don't have a problem on your skin, yes, you can use this item alone, all these active ingredients. But if you already have dry skin, losing of collagen, aged skin, definitely these active ingredients is not enough. You still need some collagen stimulation and also HA, hyaluronic acid stimulation or ingredients to replace certain loose hydration that you already have.
So meaning to say that these three categories, each of them they have their own functions.
Yes.
Okay. So but how do we choose who needs these three kinds of?
Now we come to the common questions. Right. So a lot of our client, our lovely friends and clients always go through the brand, and a lot of advertisement that you see probably will sort of attract your attention on certain brand, and show you some before after result and sort of giving you some hope or sort of attraction. So is it really true? I would say, okay, try to be independent when we are looking at this independent advertisement, because results definitely there is, but it may not mean the similar result will apply on you. So to make sure that you really benefit on doing all this treatment, first thing first is you have to make sure and understanding what is your skin condition now. Are you losing out HA? Are you losing out the collagen? Or are you losing out the function? So it's very important to first determine this point at what condition your skin is. Then only we determine how bad is your hydration losing out, how bad is your collagen losing out, how bad is your functioning problem of the skin having. Then only we determine what are the categories of ingredients is necessary for you. And if we come along on doing it, how or which one first, which one next, is also crucial, because if you have a collagen first, then your hydration will kick in better, the result will be better. If your hydration already established, then your active ingredients can go in better, and then the outcome or the efficacy of active ingredients can be more obvious and can establish better in your skin. So these are the crucial things that we have to take into considerations, right? So first of
all, it's the problem that you're
Ah,
having,
the problem
whether it's
that-
hydration, collagen, or its function. Then after assessment or after knowing, determining the problem that you're having, then we decide on the treatment that is best suitable for your problem. And based on the severity, we'll decide on how many sessions are needed, and we'll plan to along the way for a duration of about 6 to 12 months. So that will be basically problem-based based on your problem.
In general, are these treatments all very painful?
Not really. There are many ways that we can deliver this product. We can always choose a way that is very suitable for you, that you can accept, that is most suitable for your skin condition in the most painless way for you.
I think most of our product in for this purpose, like skin stimulator or skin booster, and collagen stimulator, they are all manufactured in the manner is already compatible for the skin.
Mhm.
So it doesn't cause any sort of pain sensation to the skin. So that is more sort of comfortable or easy to deliver. And together with good methods of delivering and multiple choices of delivering methods, it gives an ease of delivering to the patient. So most of the time, we just need to apply some numbing cream alone without necessary to going through a very invasive sort of like local anesthetic
Sedation.
or general anesthetic. Definitely not. And it's quite a comfortable treatment, and a lot of people can easily do it. Yeah.
Not to say it's a very fast procedure also most of the time.
And in terms of how long it lasts, I think Dr. Mesa, can you give us some idea how long this treatment lasts and how should I plan for it?
Okay, so of course for skin hydration, skin booster, how long it lasts. So again, it depends on your lifestyle, genetics, everything. But as long as the net is there, okay, the skin hydration basically can last about 1 to 3 months. Of course, we will advise you to do at least 3 sessions monthly to maintain or preserve the results. And then you touch up like maybe 9 or 12 months later. Yes.
So actually, these ingredients are already proven. By doing it, and some of it you can instantaneously see results. Some of it you need to wait at least 3 months, 2 to 3 months to start seeing the effect of the result coming out. That's why we repeat it every 2 months or 3 months, or some even 1 month. So accordingly to the products, we will repeat accordingly to the response. So some 1 month, some 3 months interval. So ultimately, the result definitely will last. All these are evidence-based. The factors that determine whether you last or not, and it varies among you and the rest, are several factors. First, your age. Yeah, the older you are, okay, the less effective you may need to repeat more. Means the younger you are, you may benefit better and you can see better result and faster result. Second, lifestyle. If you do have certain bad lifestyle that we mentioned earlier on, poor sleep, stress, unhealthy diet, yeah, so this will make your result less lasting. All right. So make sure you have a good healthy lifestyle, and you will be able to save more money on that. You may not need so much. Okay. So you can even get good result from minimal ingredients product that you need. Then of course, number three. Okay. A good assessment to determine the starting point. Then you choose the right products at right timing and right interval of doing it. It's our job to make sure you have. Then you will be able to sort of like getting the best effect out of the ingredients that you're using it. Because for example, if you are doing it for the ingredients you are doing at the wrong timing where your skin is not enough hydration, then you put in the active ingredients, then you may not benefit. Yeah, if your skin do not have collagen, you put in the hydration, it may not lock in. So these are the things that we have to pay attention. So as long as you fulfill all these things, then you will have the chance to get very close to this our topic today: crystal
Clear
Clear
glow.
skin.
clear glow
Yes.
skin. Yeah.
So
Alright.
yes, I believe we have come to the almost the end of the session.
So
for
fast,
today.
I want to
Yes,
share more.
almost 6 o'clock already.
Yeah.
Okay, so we have already gone through some of the common questions that our customers or clients normally ask, and we have also covered quite a lot of trendy treatments that are available nowadays for
Alright.
crystal clear glow skin.
Just
Yes.
checking any questions from the floor. Yeah.
Yeah, so far, okay.
So I think those are the common questions that we always deal with our patients and our clients. All these years been doing this kind of skin beautification or skin glowing treatment, and I think most of confused or misunderstanding we have cleared. I mean, explained just now, and we are also lucky to say now we have more and more breakthrough technologies in terms of the items or ingredients that we have now to give a better outcome and better results to target more challenging, more complicated conditions.
Mhm.
Yeah, so that's why it's also our honor, our responsible, our honor today to share with everyone here about these technologies and these kind of demands in the market. Yeah.
So if you have any skin concerns or you are looking for crystal clear glow skin, so don't hesitate. You can
Call us,
contact
right?
us. Yes, contact us
Yeah.
at Revival Clinic. Yeah, to arrange an appointment with us.
Mm.
Yes.
We'll be happy to assess the condition and offer a solution for you.
Yes.
Mm.
Specifically targeted plan for you. Yes.
Alright.
So based on your problem.
Now almost 6 p.m. We have one appointment for skin booster.
Yeah.
Alright, see
Okay,
you.
Alright.
see you. Thank you.
Thank you.
Bye.